My name is Ron Aker, and I am here representing myself. I'm 61 years old, and I've been gainfully employed and paying taxes since I was 14. I've played by the rules of our system. In my early 50s, I went from being employed to self-employed. And when I made that step, I bought myself a private health insurance plan. I need to name that company just to be on record. It was a Blue Cross Blue Shield premium policy. Following that purchase, within a 6-month period of time, I suffered my first heart attack. I went to Carl emergency room. The doctors and the people who cared for me there did a great job and saved my life. My insurance company, Blue Cross Blue Shield, paid the hospital just like that. They wouldn't pay a thing to Carl Clinic. I fought with the insurance company till I nearly stressed out again. They would not pay Carl Clinic. They weren't an approved provider. And when I bought the policy, I was told that Carl was an approved policy. They just failed to mention that it's Carl Hospital and not Carl Clinic. That's a ridiculous rule, by the way, Mr. Johnson. One of many that I will point out. You made the statement recently that no one in our great country would be denied health care if they needed it. I'm here to say that's not true. After I was unable to get the insurance company to pay the large bill left at Carl Clinic, things came down to, do I pay Carl Clinic the large amount that they wanted on a monthly basis, or do I continue to pay premiums on an insurance policy that got me here in the first place? A no-brainer. I started paying Carl Clinic the monthly amount and told the insurance company goodbye. A very short period of time after that, I suffered my second heart attack with no insurance. Recovered again, thanks to the wonderful care of the doctors and nurses at the hospital. To shorten this up, shortly after my second heart attack, my wife suffered an aorta aneurysm. So between the two of us, we had a large bill at Carl and Carl Clinic. The only recourse was for us to apply for and be granted medical bankruptcy. A very degrading thing to do for someone who had worked long and hard my whole life. I took that necessary step. All other debtors were gracious and quit the phone calls and the hounding, except Carl Clinic. For 6 months following the declaration of the bankruptcy, they continued to persist. But that's another story. I have continued to work, continued to rebuild my life financially, but starting all over is very, very difficult. And I will say that at this point, my wife is working now, and her employer provides us with insurance. But as far as getting medical treatment at Carl, Congressman Johnson, we're people of non-service. We have medical debt to you, or to Carl Clinic, that is unacceptable to them. If my wife has a problem of any sort, or if I have a medical need and we try to get in to see our primary care physician, we're quickly told that's not possible. I just feel that in a system like we have, train wrecked or whatever you want to call it, something must be done, and you're not listening to your people.